What's up, guys? It's Adam with Mediversity, and today we're going to be talking about the gluteal muscles and the gluteal region, which is in the posterior superior portion of our lower extremity. All right, let's get into it. So the gluteal region, you have all three gluteal muscles that get supplied by our superior gluteal artery, and only the gluteus maximus gets the inferior. It functions mostly to extend, abduct, and laterally rotate the hip. And okay, so we're going to start with our gluteus maximus muscle. It's the most superficial of all the gluteal muscles, and it's our primary extensor. So it's a primary extensor of our lower extremity. So keep that in mind. That's an obvious test question. Our origin is going to be the external iliac ala, posterior to the posterior gluteal line. Insertion is going to be the gluteal tuberosity in the iliotibial tract. Our nerve is going to be our inferior gluteal nerve. Remember, the other ones are going to get our superior gluteal nerve. And then our arteries, it's going to get both superior and inferior gluteal arteries. Please pause the video if you want to check out those bursa. So we can see here our gluteal maximus muscle. It's quite a big muscle, and it's like our big butt muscle. Okay, so it's going to insert onto that iliotibial tract and that gluteal tuberosity. So you see it spans all the way across. And then underneath, you're going to have the rest of our gluteal muscles, which is the other two gluteal muscles, plus our other muscles that will be included later in the video. So underneath, we're going to have our intermediate layer, which is going to be our smaller of the gluteal muscles, or intermediate muscle, which is going to be our gluteus medius muscle. Its primary action is it's a primary abductor of the gluteal region. So it abducts. It's located just deep to the gluteus maximus muscle, and its origin is external iliac ala, anterior to the posterior gluteal lines, and that's already going to be a trend. So all the gluteal muscles are on the external iliac ala. Its action is to abduct the thigh and then medial and laterally rotate the thigh. We have our nerve, which is a superior gluteal nerve, and our artery is our superior gluteal artery. We have only one bursa associated with this muscle, and it's our gluteus medius muscle bursa. Not as common of a bursa as the three of our gluteus maximus. All right, now we have our deep layer of the gluteal region muscles, and the final gluteus muscle is the gluteus minimus muscle. It's the smallest of our gluteal muscles, and it's going to be, origin is also on the iliac ala, intermediate to the anterior and inferior gluteal lines, so that's just inferior to the other two. Its insertion is going to be anterior aspect of the greater truncator, and I didn't make a mistake there. It should be deep just under the gluteus medius muscle, not maximus muscle. All right, and the action is going to be abduct the thigh and help with medial rotation. Our nerve is going to be our superior gluteal nerve, and our artery is going to be superior gluteal artery. It shares the nerve and artery of the gluteus medius muscle. Just inferior to our gluteus minimus muscle, we're going to have our piriformis muscle, which is a key landmark muscle, and it's usually really crossed out because you could see it as triangular. So it's really triangular in shape. Its origin is going to be our pelvic surface of the sacrum, and it's going to function to laterally rotate the thigh. Our nerve is going to be the nerve to the piriformis muscle, so it's named after the muscle itself, and its artery is superior and inferior gluteal arteries. Underneath that is going to be a superior gemellus muscle. It's inferior to the piriformis muscle, and it inserts on the unnamed fossa. It's going to be a shared insertion point as many of the other muscles, and its action is to laterally rotate the thigh. It has its own nerve, and its artery is an inferior gluteal artery. If I'm going over these too fast, please pause the video so you can make notes of each of these characteristics. We have our obturator internus muscle, which is in between our gemellus muscles, creating a gemelli sandwich. It inserts on the unnamed fossa, and it's responsible for externally rotating the thigh. And it also has a superior gluteal artery as well as the internal pudendal arteries. All right, so we went through quite a few muscles in our deep layer of our gluteal muscles, and we still have a few more. So we have our inferior gemellus muscle. It's adjacent to our superior gemellus muscle, and once again it creates a gemellus sandwich with our obturator internus in the middle of those two. Its origin is going to be the inferior portion of the lesser sciatic notch, and its insertion is the unnamed fossa. We've got our quadratus femoris muscle. It's going to be in the shape of a rectangle, so it's quite identifiable as well as our piriformis muscle. And it inserts on our quadratus tubercle of the femur. It's responsible for laterally rotating the thigh. And its artery is the medial femoral circumflex artery, a very unique artery in this area of the muscles. Okay, and we also have our obturator externus muscle. It inserts on the trochanteric fossa of the femur, and it's responsible for laterally rotating the thigh and abduction of the thigh as well. It has an obturator nerve and obturator artery because it's an obturator muscle. We have our mnemonic here. It's patched goods often go on quilts, or pretty girls often get off quick. It's a superior to inferior, and it's also all our lateral rotators of the thigh. And then our insertion on greater truncator, remember piriformis is superior, gluteus medius is lateral, and our gluteus minimus is anterior. So if we remove all the muscles on the top, we see our deep layer of our gluteal region. These are the harder muscles to identify. We see our gluteus minimus right here. It's highlighted right there. And then once again, our key landmark is our piriformis muscle. It's a triangular muscle just inferior to our gluteus minimus muscle. And then just under our piriformis muscle, we are going to have our first gemellus muscle, the superior gemellus muscle. And then when you see the gemellus muscle, so you got to think gemelli sandwich, because there's a superior gemellus muscle, obturator internus, which you're going to see just shortly, and then inferior to that is our inferior gemellus muscle. So in highlighted right now is our obturator internus muscle. And below that, or inferior to that, will be our inferior gemellus muscle. Our inferior gemellus muscle is quite short there in length. There's our quadratus femoris muscle, which is that triangular, not triangular, rectangular in shape, quadratus femoris. And its insertion is our quadratus tubercle of the femur, so it's named after the muscle itself. And then let's look for our obturator externus. Sometimes it can be difficult to see from the posterior side, so sometimes we have to kind of flip our model around to find it. And there it is right there, hidden kind of in behind the quadratus femoris. Sometimes you have to dissect that out to see the obturator externus because it heads out and it travels towards the trochanteric fossa of the femur as well. So I just removed the muscle so you could easily see it and see where it's coming from and where it kind of attaches towards. So it heads towards that obturator foramen like all our other obturators. All right, guys, thank you for the video. If you guys liked the video, give us a thumbs up and give us a follow. Thanks.